who is going to be talking to us about policy within the community health context, using COVID-19 as an example. Carrie is a master's prepared social worker by background with more than 25 years of work experience in health promotion, primary care, women's mental health, diversity, and public health. She currently works as the Director for Public Health Programs in the Calgary Zone of Alberta Health Services and is in the role of Health Service Administrator Support within the ATTACH project. Her current work is focused on services that promote the health and wellness of pregnant women, infants, and their families, and for diverse populations accessing sexual and reproductive health services. And Carrie has enjoyed her partnership and connections and support towards various research initiatives within her years of practice in the healthcare system. So thank you very much, Carrie, for giving the symposium today. And I'm going to let you take over.
Sounds awesome. Thank you so much, Kara. I really would like to thank the ATTACH research team for having me and for the interesting focus that they have in their various areas of research work. Quite an area of passion for me too, so happy to support that. And I'm delighted to have all of you here today. And I really do look forward to hearing from you in a couple of discussion items and a couple of input areas as well. I don't profess to be an expert in all of these areas. I know I can draw on your expertise as well. So thank you so much for joining this session. And if it is a last school day for any of the families online, happy end of school and an awesome summer to everyone for sure. Before I get going into our topic area for today, I thought it's important and very relevant to acknowledge that it's Indigenous Peoples Month. And I just wanted to take a moment to pause and remember those children and youth who were seriously affected and lost their lives during the time in residential schools. Every child's life matters. And I know all of you on this call believe that, and it's a very impactful time. So I just wanted to take a moment and recognize that loss, and our hearts go out to the communities and families affected. So thinking about policy within a community health and a health services context is kind of a big topic area. In my area as Director for Public Health, along with another director colleague, we have a very large scope with 2,400 public health staff in our Calgary zone, so that's both urban and rural. And in our day-to-day work, it's all over the map with our operational work, with our planning work, and certainly policy and procedure affects what we do every day. It might be a little bit in the background, but it is very impactful and prominent in what we do as well. So I thought it would be interesting because everyone on the call can relate to the COVID example, the struggle that we've faced in the past 17, 18 months. And I thought it would be helpful to highlight that example when we think about policy and the levels of impact that it has. So I would like to get a sense from all of you, if you could put your hands up either on screen or using your raised hand. First of all, if you work with a not-for-profit organization. Okay. I'm flipping through the names as well. If you work in an academic environment, please raise your hand. Awesome, thank you. And last but certainly not least, also, if you are a parent. Great to see. So for all of those reasons, that connects us, and it connects us to policy and our experience with that. And the piece, I think we covered everyone, but I also included a piece that who's been impacted in some way by COVID-19. And I think probably almost every one of us can raise our hand to that as well. So the hopes for today would be around talking a little bit about the opportunity of policy. Certainly I come from an organization that's really large and complex, more than 80,000 staff in our provincial health organization. So Alberta Health Services is the whole province, and as our caption is, we are one. And so lots of complexity in that, but I also see amazing policy opportunities for other smaller not-for-profits or business environments, and certainly in academic institutions as well have tons of work around policy as well. So I want to support you with some thoughts if you don't have a lot of policy, but may also have a need for that in some of your areas of work or perhaps volunteering. Want to support you with some thinking around that. And as mentioned, we'll chat a bit about what's been happening with COVID with respect to policy and the impact this year. So when you think of the word policy, you might kind of go, oh, not my favorite topic, or feels so big, it's a little bit esoteric or abstract. But a number of reasons why I feel policy isn't boring are listed here. So policy has the potential to have super broad impact and can generate great change as well. So though COVID is one example where policy had really broad impact and affected so many of us, there are other exciting examples of policy work where it's really impactful on a very positive note for families and for communities and for organizations. So these items are kind of the essence of policy and why it matters in our everyday functioning. So one of the other areas is that it allows for grassroots advocacy. So a recent example of that would be around the medical assistance in dying. So the MAID work that many organizations have looked into to support choices at some of the end stages of living. And that's been very patient driven and a really important and monumental policy change. So what's happening in community, what's happening in our broader patient or client populations can have a grassroots impact on how we adjust and respond as organizations. One of the things I love about policy is it has that population health piece to it, but organizations certainly have policy as well. And I also really love that it has an educational context to it. So skills and practice can be advanced for staff and for teams and for new learners. So those are some really healthy and advantageous pieces about policy for sure. It enhances our care and consistency in how we provide care and what clients or patients can expect in our system as well. And it also has the opportunity to promote equity and access and doing what's right. By that, I mean, we have a number of policies that are around things like supporting diversity, making sure that our clients are safe in the care that they receive and so forth. So these kinds of things can really set a tone for an organization and set a culture and a value and a norm. And many of them are super powerful in their intent as well. And one for certainly our academic partners is that policy is really responsive to new thinking and evidence. So as things change, whether it's something like the fentanyl outbreak and our use and a policy around naloxone distribution, or whether it's, for example, changes to safe infant sleep and how we've handled that in our education for families and guidelines as an organization, we continue to respond to what's the latest evidence, what is the need in community, and so forth. So for these reasons, policy can be really impactful and has a lot of relevance to our day-to-day work as well. So I wanted to provide some definitions around health policy because, to be honest, day-to-day it can get a little bit confusing at what level we're working with policy and in what category it fits within. So the overarching policy of an organization, many of ours are provincial and we have had over 8,000. We're trying to pare that number down. So in the province, we've had 8,000 policies and procedures overall. We're trying to ensure that they're all provincial now so that we really ensure that care and consistency. So the policy level is really about what are our principles and our rationale as an organization, as well as the audience and the applicability to whom it applies. Okay, so that's your very high level piece of the policy work. Then we boil it down, and we will also have accompanying procedures, protocols, and perhaps guidelines as well. So in the case of procedures, what you'll see is a very step-by-step piece for, in my case, it's for healthcare staff or public health staff. So it's around what are we assessing with our clients? What are we documenting in the chart around these specific aspects and so forth? So it really is a guide for practice for sure. And we do have many procedures, but it's very helpful for staff who are new or maybe haven't completed that particular assessment recently, that they can refer to this as well. So everything from domestic violence assessment, safe visit assessments if you're visiting in home, those kinds of things really come into play with our procedures for sure. And on a protocol level, we then would see more things about the responsibilities defined for each role, each team member. What would a physician requirement be? What would a nursing requirement be? What would a social work piece of the role look like as well? So it really describes some of the interventions by each team member. So I actually use the content of this slide quite often so that I have it right. I'm working at the right level to describe the need. And we're also quite fortunate that we have consultants who help guide our process with this as well, so that they help give clarity when we're needing to define some of this for each of our work areas. So what does health policy involve? In our case, this is very much about outlining the steps to care and our standards for all of our areas of practice. As I mentioned, we really focus on incorporating the evidence. We have very regular reviews every 3 years of all of our policies and procedures, or if something changes, meanwhile, we certainly take the time to update all of those as well. It helps advance our practice and skills and offers amazing reference material that staff use very regularly. It helps us with risk management. All of our policies and procedures would align with legislation, regulations, college, like our health college, like CARNA and ACSW for social work, things like that for our province. We align with all of that in our policies and guidelines for sure. And one of the pieces I find so fundamental is it sets the culture and expectation with accountability. So what does it look like for each of us as staff or as leaders, and how are we accountable for those standards and guidelines and so forth? In our areas, as I mentioned, we have many policies that would be at a provincial level, but we also will have some procedures or guidelines perhaps at a program level that are specific to us as well. And in the province of Alberta, we also have zones. So Calgary area is a zone, and we have portfolios as well where, for example, ours is community, rural, and continuing care, which includes public health as well. So lots of different levels of policy, but I feel like it has a lot of reach as well. Okay, so in a few of the examples that I was preparing for, I reflected on some of the important areas of policy work that I've seen since working with Alberta Health Services. One of them that I felt had a particular grassroots flair to it was definitely around the tobacco cessation work that began decades ago. It began very grassroots. We had a lot of community stakeholders advocating for certainly the health benefits of smoking cessation, but also where smoking would be permitted for safety reasons. So we had a history of smoking perhaps outside the front doors of hospitals or other companies and so forth. And the policy that came into place to address this was really impactful on a global scale. So lots of interesting public health examples that focus on a population level with respect to policy. There are many excellent clinical examples as well, and two that I've worked quite closely with are domestic violence screening protocols, as well as postpartum depression screening. And I felt those were really important examples. Before I was supporting a team working on the domestic violence one, we weren't screening people if domestic violence was part of their health context. And now we really are screening everywhere for whether domestic violence and family conflict is an issue for each individual. And then with that policy really allows the opportunity to support individuals and families in accessing care, which is really critical. For postpartum depression screening as well, we do a standardized screening in Alberta in our public health clinics for new moms coming in for their babes in immunizations. And we ensure that they have resources and supports for when things aren't going as well as they would like. We also certainly have a number of services designed to really address that issue. But again, really important momentum with clinicians, with patients, with committee work to advance those kinds of protocols over time. And they've been really impactful. A couple of other examples I'm listing below that had a very client-centered aspect to them. So one was around stillbirth or infant loss, and how are we supporting families through that? What kinds of things did families hope to have in place at the hospital and beyond for where this occurs? Grief support, packages with mementos, important things like that were really relevant, and we involved a lot of family feedback and community peer advocacy groups to help shape those things as well. Most recently, one that you'll hear me touch on a few times is around COVID-19. We had a very community-driven task force that was around family visitation and presence at our hospitals and sites during COVID. We had some restrictions naturally. I'm sure all of your areas face similar issues. So we had to carefully define and engage patient feedback in what could that look like? How did we need to provide alternatives for families to stay in touch with their loved ones while in care and so forth? So diversity and inclusion are super important in our policy battery, if you will, for the province as well. And other key areas are respect in the workplace on a collegial level as well. But I also want to help promote your thoughts and maybe for discussion on some of the other examples that you think have been really meaningful in a health or in your organizational context. So maybe think about that. And if you'd like to share them in our discussion, I'd be very interested in your examples as well. Many awesome examples of how policy has had a positive impact. So generally in developing our policy, I wanted to make sure you had these steps at hand in case you're considering this for your area or would look to do some further work in this area. We for sure access consultants. There are some highly specialized and trained individuals who help us through this work and help facilitate but write it as well, because they're in our work that's quite technical and clinical often. We have some very detailed needs and conversations and how it needs to be written and so forth. So consultants are key in our example area. The other thing I would say is if we just ensure we don't underscore the change management that's required with any new policies and change. It really is a process, so you can't write it one day and have it, fully implemented the next. There's a lot of work to prepare, engage, and so forth. So these are some of the key outline steps where you're looking at the flow of identifying the need for the policy procedure, engaging your stakeholders, starting to work on developing the plan together, really with as broad of consultation as you can, leads into drafting the policy. Next, one of the steps we take is then going back out to survey after we've drafted policy and further conducting consultation and ensuring everyone's in sync with the approach. And then we also have quite a formal policy approval process, especially because ours is provincial. So one that I'm working on right now, for example, will go up to all of the directors for public health around the province. We'll engage certainly all of their staffing and ensure it fits all of the areas. And then it will go to one of our lead physician medical officers of health in the province as well for approval. And the next piece is probably one of the most significant ones around implementing and socializing the policy. That's generally where your major time commitment will end up being, is working with teams so they can understand, internalize, and support and adopt the policy for their general day-to-day practice, really. Reviewing and evaluating is key as well. And then planning for those regular review periods and updating, because things change quickly. What we learned with COVID in particular, and we'll get into some examples about things changed day to day, sometimes hour to hour. So you'd get settled into one practice and something might flip the next day. Just a quick, easy example was at one point we were in all of our sites, we were using masks only for our public health care anyways. And overnight it flipped into, okay, we're doing masks and now we're also doing face shields as well for extra IP&C and protection of droplet spread. So things change very quickly with all of that for sure. So I thought, in terms of just highlighting a few of the key factors that influence policy and organizational readiness, I thought I would mention an interesting one around mature minor status. So you're probably familiar that in many areas of health, we'll have a 14-year-old, for example, possibly a 12-year-old, accessing healthcare, important healthcare, on their own perhaps, or without the support of a guardian or parent. And in that case, we need to assess that they're reasonably capable to make those healthcare decisions. And so that's something our providers do very regularly. So when you think about, you need your leadership and staff to understand and support this, it has to be supportive of our organizational values and our structure. We make an effort, of course, with this to be adaptive and inclusive for our clients as well. But we also have to follow what is the legislation and accreditation and any regulations kinds of things with our mature minor assessments as well. So we're doing a current update where we're going on to one provincial health record over the next couple of years, and we're wanting to protect that minors, that their charts and their information be confidential to them. So we're currently engaging youth in that process and sort of defining at what age the parent should no longer have access to their medical health chart, or in what situations maybe the parent shouldn't be able to access that. So where this often comes up in one of my program areas is in sexual and reproductive health, where a youth is accessing birth control or perhaps having STI testing and things like that. So all of these play into this, this type of approach in our policy. So we look at what are the safety aspects? What is the evidence saying? Should it be 12 years old that we remove that parent proxy access, or 14? We're looking at other jurisdictions in that evidence as well. And then we want to remain responsive to some of the issues around this as it does change as well. So that's just a bit of a highlight example, but I feel like these are some contextual factors that influence policy and whether your organization is ready for the development of that policy in practice as well. So when we think about COVID, these will be super familiar to all of you. A couple of the policy areas that I picked to highlight, for example, were around the preventing the spread. So all of our jurisdictions looked at masking or PPE in the healthcare context, distancing certainly, visitation in health sites and access were impacted by, minimizing our numbers and access and things like that. When you think about no matter what the province, the closing and reopening had significant impacts to people. So everything from schools to restaurants and bars to what you were able to do in your own home as well. And then certainly events and ceremonies, whether that be funerals or weddings, conferences. Certainly attached education has been slightly set back as well without the in-person ability to have those sessions together. And then lastly, one where we were very involved this year was around vaccines. So what were the policies around prioritizing groups? And how did we address vulnerable populations? Even the vaccine types, who could access what, at the different ages and when, and the staging and sequencing of all of that. So very complex, and all of these areas had many versions of policies attached to them and affected, again, all of us as a broad population. I just mentioned down below some of the groups involved in supporting some of that decision making and policy as well. So certainly in our example in Alberta, there was significant involvement and leadership from the government for sure, the health ministry and Dr. Dina Hinshaw and cabinet as well. They often set the very high level, more global policies and requirements. So through ministerial orders, and then we would follow that and align our policies to reflect some of those provincial decisions. So I was part of the Alberta Health Services Vaccine Task Force, where we looked at other things like, how do we operationalize this? What does this mean for patients? How do we care for vulnerable populations? That type of thing. Quite a complex process, and I think basically everyone was involved in some way in our healthcare system around implementing this for sure. So people definitely noted, as I'm sure all of you would and communities and families would, that it can be quite change fatiguing to go through all of this and open up and close things again, and lots of shifts in direction as well. So I do want to try a little feedback loop with you, and I thought we would reach Menti for this. So you've probably seen word clouds done in the past. So if you have the ability to, if you can go to www.menti.com, it's on the screen there, and it'll ask you for a code to enter. And what I wanted to understand from you are some one-word or very short two-word phrases that captures how it affected you. So some people, for example, said that, they felt isolated or that they were overeating. How did it affect you and perhaps your clients or your community? So check out menti.com, enter your keywords. You can enter up to 10 using that password, and I'll just give you a moment or two, and it will create a bit of a design of some of the sentiments that we've observed. Awesome. I see them coming in, and then what I'll do is I'll share that screen with you as well. Can you see this new screen with our word cloud building? Just check.
Oh, now we can.
Sorry, yeah, I just needed to click one more button. So lots of themes there. This is an excellent example. Thank you for your input here. So everything from sentiments of isolation, stress, fear, anxiety, to some interesting ones like self-led learning, changes our online reality, but it was disruptive, the family impacts, the confusion and frustration. I think all of those are completely normal. And thank you for sharing some of that feedback as well. What I also want to touch on was that there were serious impacts for our clients in all of this as well. And it's been quite a difficult time for everyone on a personal and professional levels to juggle and manage all of this. So absolutely what you're suggesting is so important and so real for what's been occurring for everyone in the community, I believe. Thank you for your thoughts with that. So this was one that, I had sort of generated financial grief for many people, substance and alcohol use, mental health, you name it, parenting and relationships were also touched on in yours, really important areas. So one of the things in health that we're trying to be really mindful of with the impact of these various policies and changes with that, what's happening for children and youth. So some of the information I've been able to gather, which is a bit retrospective, but about 1 in 5 children actually had COVID to date. We had a serious increase in mental health related presentations to our emergency department in Calgary. So 65% increase, which is worrisome. And I think about this now moving forward. Significant changes to the amount of time families needed to spend in the childcare aspect in their households. I attended an excellent presentation where people were commenting around the children with special needs, and in some cases, service access really quickly was interrupted or halted, or perhaps went virtual, which isn't the same and doesn't work the same for everyone either. One of the All Our Families COVID study findings was that participating mothers who responded to the survey, they had a great response on their survey. Basically, the self-reported depression doubled, so it went up 18%. In that same study, the loss of income was significant for families. So some families reported losing all income, 20%. And others lost at least a portion of their household income, which was more at the 58% mark. So everything from spending a lot more time on childcare or happening to help your family with the school online or things like that. Certainly women in some of the studies were shown to have a bit of a disproportionate weight of that load in caring for children and helping with the schoolwork at home and so forth. Several countries reported an increase in the domestic violence that was reported. And certainly a number of Canadians are consuming more alcohol and perhaps other substances, just given to the many factors of isolation and finances and stress and so forth. So all of these are very challenging experiences of the impact of COVID policy and where that took us. And so one of the things we're now looking at as a system is how do we help with the recovery phase? We're probably just now beginning to open our services more fully. In our case, we still have a large number of redeployed staff for the summer months while we're immunizing and ensuring everyone who wants first and second doses has access to that. So we've really had to reduce some of our services, unfortunately, and we've had to defer many cases. So this is something we're going to continue to work on for a while as well. What I'd like to hear from you towards the end of our session is, what are you hearing and what else have you observed among the families that you're involved with and support as well? So some of the reflections of what worked well in the process around COVID-19 response, but also that tied into all of the policy and procedure development. We had excellent provincial coordination, and it had a lot of efficiency because of all of our health zones being connected. So we had this one governing body that then determined the direction and could be implemented very consistently across all of what we call the zones. We paid significant consideration and attention to our vulnerable populations and still are. So we had specific strategies for immunizing our long-term care clients, reaching our Indigenous communities both on and off reserve. We've reached all of the shelters in the area, and we've also paid particular attention to anyone working in areas of density or living in areas of density. So things like meat packing plants and corrections and so forth. So that was a real strength of the process and the policy and procedure that we implemented during COVID and how we approached our immunization rollout. We were careful to attend to, the safety of our patients and clients at our sites. We were very, if you attended any healthcare sites during this time, you would notice that we really carefully followed and screened clients entering our sites. We made sure we had an online screening tool, for example. We made sure everyone had appropriate PPE. We were very careful that people hadn't been tested positive for COVID before accessing and coming into our sites and services, which was challenging for sure. And I know people might wonder about this one, but when my colleague and I were thinking about when vaccine would be available, we never dreamt it would be available last December. So I say it was a relatively quick vaccine rollout because we were thinking right now would have been the earliest to receive vaccines. So I feel like internationally we were very fortunate to be able to have that opportunity in Canada for sure. So at this point, in Alberta, we have 70% of our immunizations, our first doses completed, and over 30% of our second doses completed. And we would like to keep reaching those isolated groups or groups that have difficulty accessing services so that we can increase that number. And one of the reasons that it's been articulated that our percentage is just slightly lower is because we also have a really young population with many children under 12 who aren't yet eligible for immunization as well, but hoping that some guidelines will come out about that in the near future as they continue to research and look at the evidence. So in our process, and like with any policy as well, you need your champions, you need your executive sponsors, you need your stakeholders, and certainly your interdisciplinary teams advise and create, but also implement all of this important work as well. And we had a scientific committee as well to help us with the evidence-based material. So all of those pieces were really key to the response as well. And one of the things that I think is quite eye-opening, and I think will continue to a good degree, was around the virtual health. And we've included that for our services, but also for our families who couldn't see loved ones for various reasons, restrictions, and so forth. So I think that will continue on, and it's one of the recommendations of our system that we at least have a blended model to include some of that as well. In many ways, it's client-centered. In other ways, we have some work to do for sure, but for education, for easy access, for clients who are isolated or not very mobile, many of these were excellent ways we strengthened services during this time. Some of the things that I feel in reflection that we would have liked to have improved upon, though, When I hear the stats around our children, youth, and families and the mental health concerns that they faced with the isolation and the anxiety, I think that's something we're going to need to put a lot of focus into in coming months. And it was something that, while we had, phone places and distress center lines and things like that, that there wasn't enough ability to reach people in this way. So I think something, if we ever had a situation like this again, that we would need to put a lot more resources earlier into those areas where families were struggling. My next comment is just a little bit about how politically challenging the environment has been. I'm sure every province and jurisdiction has felt that as well. And I'm just looking, it's hard for me to see every comment. There we go, yes. Our workforce has been tremendously challenged. We haven't had the amount of staffing actually even available in the broader community to do what we've needed to do. So we would have to staff up faster and earlier and have those healthcare pools and other pools in abundant supply. Contact tracing, immunizing, helping on the ICU units. We certainly needed a ton of workforce for this work. So I touched on a little bit what's next. We're gradually reopening. Our healthcare sites will be a bit slower to reopen than perhaps the grocery stores and soccer games and things like that. So we will continue with safety measures in our settings, and we will continue to adjust the policies and procedures around that. And we make a very deliberate focus to reach out to communities so they know what the latest is, what to expect, what can you do in terms of visitation, and so forth. As I commented, we really want to attend to mental health impacts of people in the recovery phase. And I think a lot of that will involve our partnerships and referrals, and how can we generate more momentum in that and ensure people are supported as well. So I know it's very quick, and those were some of the things that came to mind when I thought about a real life example of implementing policy and the scale of the impact, with a few strategies that you would want to look at. But I want to, wrap the formal part of the presentation with saying, stay connected. Please look after yourselves and attend to your needs, and make sure that you stay safe. And I hope that this reopening will be positive and a relief for people, and it will be a time of recovery for everyone, for sure. So I really thank you for joining me in this, and I'd love to get some of your discussion items, if you want to put them in the chat window, questions, or even some of the reflections that you observed among your clients, families, and communities around COVID and the impacts of policy as well.
Thank you, Carrie. Virtual applause all around. I appreciate it. And lots of clapping coming from everyone on the list as well. Thanks, everyone. So the discussion comments, ideas, questions, please feel free to put those in the chat. While you're busy typing away or thinking, I have a couple of questions to kickstart us off. And first of all, thank you so much for that, Carrie. It's weird because I do health-related research and it dances around the question of policy, but I've never had an opportunity to have someone sit down and explain what is policy. So this was very helpful. Thank you very much for that.
Thank you.
One of the first questions that popped into my head was that, how do you think that the pandemic is going to be affecting how policy is rolled out in the future? Because a big part of the ATTACH project is focusing on, how do we test an intervention and try to roll it out and help people, faster than has traditionally happened in research. And I know that they were able to make more efficient the vaccination development process. So how is that also going to be affecting, you think, people's expectations around how quickly policy can be developed and rolled out?
You know, that's an excellent point, Kara, and I'm going to take that back. I'm working with policy quite regularly right now. You're right. We need to be more nimble, and we need to be more nimble in obtaining feedback as well from our key stakeholders. And I really love like patient and community involvement and all of that. So I'm wondering if perhaps there's a way to do it a bit more virtually as well, like almost an in vivo designing as you go, because we have a bit of a history of a policy can take a couple of years in its thorough nature and so forth. And I definitely saw some of this work in COVID. So our family presence and visitation committee, for example, we had, yes, it's basic, we had a SharePoint where things were all being drafted and we could give very up-to-date feedback and updates. Then we would come together as a task force, review the key principles and agree to how we were going forward with it. So that worked really well to have a bit of a virtual thinking platform. We certainly used Zoom virtual health to churn this out more quickly, and we had really tight deadlines because things were changing so quickly as well. Just weekly updates in that particular area. So those are a couple of things I'm thinking of off the top of my head, but I would be interested in any of the group suggestions as well. I guess, you know, just going to that sort of more engaging design process that's quicker and has a virtual platform. Does that help at all?
It's going to be interesting to see how things roll out as so many changes have happened, and it's going to be cool through recovery to see what sticks and what changes. Yeah, yeah. We have some questions that have popped up in the chat. So the first one is from Angela, and she asked, how is Indigenous data sovereignty controlled and included in Alberta's health policy?
Oh, that's a great question. So I'm not directly engaged with that aspect, but we have a team dedicated in the province to looking at some of the issues and evidence that is out there. What I can say is that in the COVID example, we looked at immunization vaccine hesitancy rates. We looked at issues of isolation, the ability to reach members of any given Indigenous community, like some obviously are very remote in Northern Alberta. We looked at all of those types of data or historical experiences and made sure that we had ways to overcome that so that we were supporting the community. So there was a ton of engagement with actually a very high level with government, with the chiefs, and with our Chief Medical Officer of Health, Dr. Hinshaw. So there was early on a really strong recognition of this in a way that they engaged and were open about, here's what we expect the need to be, and here's how we want to reach our families with immunization in a culturally appropriate way, so that they could, the clinics were on reserve, that they were a much more culturally supportive milieu for families and individuals to come, that type of thing. But I absolutely agree that for all of our diverse cultures and our diverse gender communities and all of that, that we need as much as that type of data to inform policy as possible, and very much so with stakeholder groups involved as well. I hope that helps a bit.
Thank you. And if there's any follow-ups to these questions too, please feel free to put them in the chat as well, as if there's any other comments or questions that come up as Carrie's answering any questions. From Simone, when are the vaccinations for 0 to 12 age going to be available? Will it be in time for school in the fall?
That's an awesome question, Simone. I feel the same. We're all super keen for this. So I understand that research is underway on some of the vaccines in these younger populations. I've heard that the UK is doing some of that work, for example. And then in Canada, a place to keep an eye on is the National Advisory Committee on Immunization, NACI. And they review all the evidence and make the determinations on vaccine types and populations and availability. So for example, right now you'll know that, well, at least in Alberta, we're immunizing 12 and up, and that is a NACI recommendation, and we're using Pfizer only at this time until I hear that Moderna could potentially be approved for that group as well. So NACI really guides all of these and sets policy on them. It is all on their website as well. I've used their procedures a lot during all of this process and their policies and guidelines. So I'm hearing rumors that this could be the case, and we would love that. We would love to support that work, and perhaps it might even occur at schools in some time in the future as well. So I'll keep my fingers crossed for you too. Thank you for your interest in it.
Thanks. Another question from Martha. With the emphasis on patient engagement in healthcare, were health-related policies associated with COVID-19 able to utilize patient engagement?
It's a great question, Dr. Hart. We definitely had patients involved in various aspects. I worked with one group that did, our task force on visitation and family presence. So, whether you could see your loved one in continuing care or acute care. So we had quite an advisory group of patient family members on that. And I believe as well that there were some other touch points with our provincial task force. But you're right that this is an exciting area for further growth and development. Pretty much all of the research and policy work we're doing these days engages that voice, and I want to absolutely see that work. So for example, we've been doing a lot in the area of gender diversity and how should our services be reflective and what are the needs and concerns of our patients in that area. So absolutely need to have more touch points with that. How AHS has set it up is that we have some standing health advisory groups, and they support and allow consultation going to them on a variety of topics. So COVID, definitely we would have taken advantage of that work, and we try to include formal, like Simone is on our group, formal relationships with parents and communities and families. We also have a lot of community organizations that have participated with the work and are reflecting some of their community members' concerns. So we worked extensively with mosques, Ismaili community, with various backgrounds, the Indigenous, the Métis associations. We had extensive work with community partners. Right now, we're now outreaching to our many Hutterite colonies and having leads from those communities also give impact or help us inform the ways that they need support and resources rolled out to them. Schools would be another example. So a lot of community development and community engagement in that process ongoing. Shelters is a really important one. I was very involved in a project early on where we knew that outbreak of COVID could be very significant in our homeless population. So very early on in our testing and assessment, before we had vaccines, we were at shelters helping with testing and early identification so that we could protect the community by having them in their own private space if they tested positive. We had a designated hotel as well for people who were without shelter and needed to safely isolate. So lots of organizational and community involvement. If I put together a list on that, it would be really lengthy. And that, for me as a social worker, those are the exciting pieces of a response effort, like something like this.
I am just gobsmacked by how complex it is.
It really is. That's a great word for it, Kara, and it, kind of overwhelming, but I've gone back to this many times. I know you all love this phrase. It takes a village, and it certainly did in this effort as well.
Mm-hmm.
Much more
so
than
many movements. Yes, yes. I'm getting lots of compliments and thank yous in the chat for your talk, just as a heads up. And a couple more questions. So first of all, a follow-up to Simone's question about the, I believe, the 0 to 12. Whether there's been any rumors or inklings that there might be special exceptions around special needs children. For example, the 0 to 12 who have special needs, that might be affecting any of the vaccination policies.
Yeah. So in my observation only, I mean, we talk about our crystal ball, which is kind of cloudy at times, we feel, but my observation is that they launch an age group or approve the safety for an age group. But then that as far as prioritization, then as far as the rollout, that's where they would look at some of those specialized factors. So I would see that being a really important early group to receive doses, you know, so you might not, depending on your supply and your sites and things, you might not say, okay, it's open to everyone 0 to 12 today. Instead, you might say, but we're starting with those who are homebound clients or have some challenges, you know, accessing services, things like that. So great point, Simone. And I definitely think we really look at the vulnerable populations in terms of the prioritization for sure. So I definitely, one of the things in Alberta we did was that caregivers of any individuals at home or with challenges, they were prioritized as well and were quite early in our immunization sequencing, which was really important to protect them too. And fortunately, we're really quite relieved that overall the child and youth group demonstrates a lot of resilience to COVID and the illness. So we're very fortunate about that.
Well, we have 2 minutes left and one more question, so we'll see if you can do this in 2 minutes. But the last question is, what is happening in the choice to die in regards to the COVID situation? How is that being handled?
As far as I'm thinking that they mean the MAID example. So one of the things, I'm not an expert in that area, but you have to arrange that before you're critically ill. In the case of MAID, where you're planning ahead. ICU colleagues would be the ones that have this kind of experience, but for certain, you know, there have been important family engagement around that and a lot of challenges because people have been on respirators for months at a time. And so very, you know, very difficult for sure. What we did implement was that every one of our patients could have a designated support person with them, and that they, you know, they are identified by the patient and family as the one who can support the client with their care and their emotional health needs, but also with some of the decision making. So I don't have a lot of detail to share how that played out, but we would practice our same process of consulting with, if it's guardians or family members identified by the patient and that type of thing. One thing that was challenging with this illness is I heard from colleagues that those who came in ill to acute care progressed really quickly. Like within 48 hours, if you were going to become significantly ill, it would then, you know, you could be on a respirator very quickly. So all the more important to stay safe, stay connected, ensure your loved ones are protected and immunized, and we're hoping our communities will be safer going forward with all of that for sure. It's a tough area, that one for sure, because families were missing having their loved ones and extended network at this time. Mm-hmm. Those are some really awesome and thoughtful questions, and I just want to thank you all again. I really appreciate you carving time out of a busy summer day in your lives, and I really wish you a great, relaxing summer.
Thank you again, Carrie. A big applause again. This was wonderful. Thank you again. We really appreciate it. In terms of, it's 1 o'clock, so just in terms of July, we're going to be talking about OCAP. So I will be sending out information about that later as we get closer to that. But in the meantime, again, thank you everyone for coming, and keep an eye on your inbox. And this will be available on the attached Teachable as well, so you can watch it again if you like. All right.
Sounds good. Thank you, Carrie.
Thank you
that
so
was
much, everyone.
fantastic. So interesting and
Thank
well
you.
done.